As you know, last week, Governor Raimondo issued an executive order to address the nationwide and statewide epidemic of youth e-cigarette use. Today, the Rhode Island Department of Health filed emergency regulations with the Secretary of State to promulgate banning the sale of flavored electronic nicotine delivery systems products, also known as ENDS, also known as e-cigarettes or vaping devices. So these new regulations for businesses that sell ENDS products will take effect in Rhode Island immediately, and it will last 120 days. Again, the regulations are banning the sale of flavored ENDS products, e-cigarettes, or vaping devices. Letters are going out today to all licensed ENDS sellers and all licensed tobacco retailers in the state of Rhode Island, advising them of these new regulations. The regulations are also posted on RIDOH's website at www.health.ri.gov. We wanted to make sure that we share with you today why we are doing this, the rationale. As we discussed last week, this is really about protecting our youth. E-cigarette use among youth is a public health epidemic in Rhode Island and across the country. And the intention of this urgent step is to halt the sale of flavored e-cigarette products so that our youth, which are drawn to flavored e-cigarettes, can be better protected. When we say flavored, we mean anything that tastes or smells like anything other than tobacco flavor or unflavored. Examples include, but are not limited to, mango, cucumber, cherry, grape, cotton candy, mint, menthol, vanilla, and others as well. Data show that 20% of Rhode Island high school students report regular use of e-cigarettes, and 15% of middle school students have experimented with e-cigarettes. That compares to 5% of adults in Rhode Island that use e-cigarettes. Given that, and the fact that we know that e-cigarettes contain nicotine, which is dangerous and addictive for young people, we wanted to make sure that this important step was done. An example of the significance is the nicotine content of one Juul pod for e-cigarettes is the equivalent of smoking one whole pack of cigarettes. Research shows that flavored end products are what gets kids hooked. And I want to be clear that this step is a starting point. We are banning flavored products because we know that is what youth are drawn to, and it's in the midst of this epidemic of e-cigarette use among youth. We're being very thoughtful and deliberate about this process. We took the week as well to be able to hear from people on both sides of the argument here and go forward with what we feel is strongest for right now. We will be pulling together a vaping advisory group, work with experts from across the state, and look at the data. The goal for this is to be evidence-driven throughout the process. Based on that information, we will continue to make steps and improvements in how we are approaching this. It's a very dynamic process. We are learning more every day about what's going on, not only in Rhode Island, but also throughout the country. So thank you, and I'll stop there and take any questions.
Can you speak to how you'll be enforcing this, working with law enforcement? And when you say it takes effect today, we're talking like 4:15. What time exactly did this take effect?
So starting with enforcement of these regulations, This will be an interagency effort. We're working very closely with our state agency partners in using existing inspection program processes and resources. The immediate action does take effect this afternoon. We will be working through a phased-in enforcement process. There will be the importance of inspecting the retailers that are selling products, making sure that people firsthand understand the new regulations, receive the warning that they need to, and that we are collecting that information and are ready to respond to it. We want to work with vaping shops, making sure that this information is known, and then be able to take action as we go forward.
So tonight, realistically, someone could still go to a shop and buy vaping products?
We're strongly encouraging that people stop using vaping products, and the flavored product ban is the way to be able to do that. We want to work with stores that are selling it to make sure they understand the regs, they know what's out there, and can do what they need to do to remove the flavored products from their stores.
So is there a penalty if the stores, if you find out the stores are still selling them even though they're not supposed to?
We will be enacting the current processes in place. There is a due process that works through how to respond if someone is violating the rules the way we have them. And that due process can range from penalties of fines to revoking of licenses.
Is there a time frame? So, okay, it goes into effect today, but is there a time frame for when everybody's going to have this off the shelves?
We want people to start working towards this as soon as possible. And we'll be initiating that warning process and collecting that information and returning to folks who have received warnings and haven't begun to heed them to address that.
I'm sorry, do you know how many establishments are licensed to sell e-cigarette products in Rhode Island?
We have about 400 or so throughout the state that are specifically doing the e-cigarettes products.
How about online sales? How does that work when it comes to a specific state, you know, with people buying them in Rhode Island if they were to buy them online?
Yes.
Regulate that?
We also, for those that we are overseeing, this ban for flavored products not being sold does apply to the online shops as well.
400 stores, that's a lot. I mean, Rhode Island's a small state, but that's a lot of stores. When you talk about the inspection agencies that will be doing this, are we talking law enforcement? Are we talking city and town code personnel?
There is an interagency collaborative effort working towards this, tapping into the authorities that currently exist across agencies. The Rhode Island Department of Health, Department of Business Regulation, Division of Taxation within the Department of Revenue, our colleagues at the Department of Behavioral Health, Developmental Disabilities, and Hospitals, as well as our law enforcement partners.
Okay.
When will those inspections start?
Now that this has occurred, we have distributed the information to licensees and will begin working with the retail stores over the course of the next several days.
So what's your message to businesses who are going to continue selling this until they get caught?
Really think about the youth. That is what this is about. We understand sales and businesses wanting to stay afloat. Our focus here is protecting youth. And we've had many businesses reach out and say, we agree that this should not be sold to youth, knowing the addictive properties that are in place. And we want to really emphasize the importance of that for businesses, for families, for youth themselves.
What about the people that are saying this is how they quit cigarettes and they're worried that they'll end up addicted
Right. A key for those folks which we have prominent in mind is, one, making sure that there is availability and access to our smoking cessation services. We strongly encourage, whether you've tried it in the past or not, to please use our smoking cessation hotline, 1-800-QUIT-NOW. Anyone 13 years of age and older who smokes or vapes is welcome to call that and have access to services that exist: counseling, in-person treatment, nicotine replacement therapy. For those who need to continue to vape and try it again and want to have the vaping as an option, it's why we still have the flavorless tobacco form as an available option for people.